Hello, my name is Jones Muna. Today, we are going to look at Hydrocephalus in Pediatrics. Our guideline will be as follows: introduction, definition, types, assessment, and lastly, management. To start this discussion, let me say that cerebrospinal fluid is produced in the ventricles, and in the choroid plexus. It circulates through the ventricular system, in the brain, and is absorbed into the bloodstream. This fluid is in constant circulation, and has many functions, including to surround the brain and spinal cord and act as a protective cushion against injury. It contains nutrients and proteins necessary for the nourishment and normal function of the brain, and carries waste products away from surrounding tissues. Hydrocephalus occurs when there is an imbalance between the amount of cerebral spinal fluid in short CSF that is produced and the rate at which it is absorbed. As the CSF builds up, it causes the ventricles to enlarge, and the pressure inside the head to increase, an imbalance of CSF absorption, or production caused by malformations, tumors, hemorrhage, infections, or trauma. These results in head enlargement, an increase in intracranial pressure in short form ICP. Now, let's define the condition under discussion. Hydrocephalus is an abnormal accumulation of cerebrospinal fluid within the cavities, in the brain called ventricles. Let's also review the production and flow of cerebrospinal fluid, or CSF. It is produced mainly by a structure called the choroid plexus in the lateral, third and fourth ventricles. It flows from the lateral ventricle to the third ventricle through the interventricular foramen, also called the foramen of Monro. It is absorbed through blood vessels, over the surface of the brain, back into the bloodstream. Note, approximately 500 milliliters or a pint is produced in 24 hours and continuously reabsorbed. Let's discuss types, now. A. Communicating. 1. This type of hydrocephalus occurs as a result of impaired absorption within the subarachnoid space. 2. Obstruction of the cerebrospinal fluid flow, in the ventricular system, does not occur. B. Non-communicating. Obstruction of cerebrospinal fluid flow in the ventricular system does occur. 1. Non-obstructive, or communicating, hydrocephalus occurs when the CSF flows out of the chambers of the brain ventricles and into the spinal canal, but it is not reabsorbed normally by the tissue surrounding the brain and spinal cord. Sometimes this type of hydrocephalus corrects itself. 2. Obstructive, or non-communicating, hydrocephalus occurs when the CSF does not flow properly between or out of the brain ventricles, because of an obstruction, such as from a malformation or narrowing. Infant assessment or observation to be done includes, a. Head circumference assessment, which will review an increase in size. b. Thin, widely separated bones of the head, that produce a cracked pot sound on percussion, which is called Macewen's sign. C. Anterior fontanelle are tense, bulging, and non-pulsating. Sutures will separate prior to fontanelle bulging. D. Dilated scalp veins. E. Frontal bossing. F. Setting sun. Eyes. Other assessment for a child may review: 1. Behavior changes, such as irritability and lethargy. 2. Headache on awakening. 3. Nausea and vomiting. 4. Ataxia. 5. Nystagmus. Late signs may include high, shrill cry and seizures. Let's now discuss the management. Surgical interventions. 1. The goal of surgical treatment is to prevent further CSF accumulation by bypassing the blockage and draining the fluid from the ventricles to a location where it may be reabsorbed. 2. In a ventriculoperitoneal shunt, the CSF drains into the peritoneal cavity from the lateral ventricle. 3. In a ventriculoatrial shunt, CSF drains into the right atrium of the heart from the lateral ventricle, bypassing the obstruction. This is used in older children and in children with pathological conditions of the abdomen. 4. Shunt revision may be necessary as the child grows. 5. An alternative to shunt placement is endoscopic third ventriculostomy, in which a small opening in the floor of the third ventricle is made, that allows CSF to bypass the fourth ventricle, and return to the circulation to be absorbed. This treatment may not be appropriate for some types of hydrocephalus. Now, nursing management of this patient. Firstly, preoperative nursing interventions will include: 1. Monitor intake and output. Give small, frequent feedings as tolerated until preoperative nil per oral status is prescribed. 2. Reposition the head frequently and use special devices such as an egg crate mattress under the head to prevent pressure sores. 3. Prepare the child and family for diagnostic procedures and surgery. On the other hand, postoperative nursing interventions may include: 1. Monitoring vital signs and neurological signs. 2. Position the child on the unoperated side to prevent pressure on the shunt valve. 3. Keeping the child flat, if prescribed to avoid rapid reduction of intracranial fluid. 4. Observe for increased ICP. If increased ICP occurs, elevate the head of the bed to 15 to 30 degrees to enhance gravity flow through the shunt. 5. Measuring head circumference. 6. Monitoring for signs of infection and assess dressings for drainage. 7. Monitoring intake and output. 8. Providing comfort measures, and administer medications as prescribed. 9. Instructing parents, on how to recognize shunt infection, or malfunction. 10. In an infant, irritability, a high, shrill cry, lethargy, and feeding poorly may indicate shunt malfunction or infection. 11. In a toddler, headache and a lack of appetite are the earliest common signs of shunt malfunction. 12. In older children, an indicator of shunt malfunction is an alteration in the child's level of consciousness. Thanks.